Hello and welcome to Herbalist and Herbs. My name is Chrissakis. Today's video short, Enhancing Chemo. Now, I want to take this from the direction of enhancing chemo from using expanded diagnostic testing. And what that would mean was getting more information to the chemo docs before they made the decision as to which drugs to use on which patient. Now, this is a major problem because apparently things are not working out well. It is not uncommon as a clinician that you see people on their fourth or fifth round of a chemo agent because the first 3 or 4 or 5 have failed. So the attempt of this article is to bring some light on technology that's out there that could easily be incorporated into standard procedure in terms of oncology to get better results with the chemo. That is, getting more information to the docs so they can make better informed decisions. So let's start with the example of a breast cancer patient who has a small tumor. So the general protocol would be a surgery, which would be a lumpectomy, then chemo and or radiation. Now, starting with the surgery, the lumpectomy, if there are laboratories that do fresh tumor sampling, and what that means is after this tumor is excised, a section of it is sent to the laboratory, and what they do is they test drugs against the live cancer cells to see if they're sensitive to the drugs. This is a great idea. Now, these things are not covered by insurance. They're rarely done, and they are not hard to do either. These laboratories have been around for quite a while now. The names of the laboratories of the type of tests that I'm going to talk about are in the companion article that is on my website, Herbalist and Herbs, Enhancing Chemo. To get back to this, they send a fresh section of the tumor to the laboratory, they test the chemo agents, and then you have less chance of making a mistake with that kind of information. Now again, this is not standard protocol. You can have it done. If you order it, it will cost you multiple thousands of dollars out of your pocket. But if you can afford to do it, it is an excellent thing to do. The next thing is genomic testing. Genomic testing, there are a few laboratories out there that do that. Some of them test 25 or 30 genes, others test up into the area of about 70 to 75 genes. And what they do with that is to determine what the chances are of recurrence. This way you can see which person is more at risk or less at risk, and that once again can help add information into your protocol decisions in determining chemo. The next thing is called S&Ps. These are single nucleotide polymorphisms. You know, it's a very tongue-tying name, and it sounds big, but basically what they are is they are functional mutations in the gene. They're not actual breaks in the bases the way general classic mutations are. The gene is formed properly, but it is just not working right. So this has to occur in more than 1% of the population in order for it to be classified. So to give an example, as I do in the article, of a gene site, MTHFR, that they look at and determine if that gene site's been damaged. If that's the case, the person who has that problem will not metabolize folic acid properly. Now, there are chemo drugs called antimetabolites, and one of them is called methotrexate. It's pretty common. Methotrexate interrupts the absorption and utilization of folic acid because cancer cells need the folic acid too. Unfortunately, if people have this S&P, the methotrexate will make them sicker, not better. So again, you can see we're testing for a variety of S&Ps, and what the S&Ps can tell you is things like, can you metabolize the drug and can you excrete it properly? Because again, some of these drugs become very toxic if we cannot get rid of them properly. The next thing would be your simple frontline tests, which would be your CBC, your metabolic, your lipid panels. And then you want to check out specifically for coagulation factor, because cancer likes to hypercoagulate, and there are many pre-existing conditions which can create hypercoagulation. The problem with this hypercoagulation is many of the chemo drugs really push it hard, so that if you take the drug and you have this problem in you already, you can die from it. You can throw a clot and die from it. Now, many of these tests are not done, and they're quite simple frontline tests. So as I mentioned, CBC, metabolic lipid panel, those are common frontline tests that are done. But things like HbA1c, D-dimer, insulin, uroplasminogen activator, things that are indicating thickening of the blood are rarely put in as add-ons. And these things can give a lot of information. Also, things like homocysteine and C-reactive protein can indicate if there are other problems in the bloodstream that if you put the chemo agents in, you may have a negative reaction to. But clots are a specifically large problem, and a number of chemo patients get sick from the drugs due to this. Now, if we test these things in advance, especially things like D-dimer and fibrinogen, you can see if the blood is already getting thick. So if you give them that particular drug, they're going to get much worse in that direction. Another problem is a person who is insulin resistant and or type 2 diabetic, because those two things both create the foundation for thickened blood already. So again, just simple frontline testing can be of a major value in determining which chemotherapeutic agent to use. Now, there is also molecular profiling, tumor analysis, and biomarker analysis. And again, these are companies that do specialized work in the cancer cells to determine things like which growth factors there are, which receptors they are, whether they're amplified or not, and what are the genetic mutations driving the cancer. Again, these are major ideas. A number of things that we've discussed already also go into the cancer developing multi-drug resistances, which is again a big problem in terms of the failure of the chemotherapeutic agent. A lot of this information can determine whether the cancer is already multi-drug resistant to a particular drug because it's got an accumulation or a profile that shows it to be that way. This is possible to find out right now. With the amount of testing that I've just added, much of which is never used, you can add a wealth of information into an oncologist doc's work so that he can see what he can do to make more informed decisions and less mistakes, less guessing, less shooting in the dark. And this is a big deal in dealing with drugs as toxic as chemo. So, once again, if you want to know more things about this, there's more on the website, and there's more on this particular subject in the article. The website is herbalistandherbs.com. Please go there and take a look, and thanks for taking the time to watch this video.